Now, part 17 of emergencies in first aid, and to talk about fractures. A fracture is basically a break in the continuity of the bone, and there are different types of fractures. You can have closed or simple fractures. Here, there's no break in the skin over the fracture site, so the bone is broken, but the skin is not broken. That is closed or simple fracture. And an open or compound fracture, here the skin is broken over the site of the fracture. So the broken bone may or may not be protruding through the wound. So the risk of infection is very high here. There is also a complicated fracture. A complicated fracture, these occur when the jagged end of the bone fragments. uh, so there's also a complicated fracture. This one occurs when the jagged ends of the bone fragments get to damage blood vessels, nerves, or a joint. That is a complicated fracture. So broken bones in the chest may penetrate the lung, heart, or liver. In fractures of the skull, the brain is going to be usually damaged. So you can see that this one is very bad. There is also a green stick fracture. This is a closed fracture mostly in which occurs in children. That is what is known as a green stick fracture. Depressed fracture. These are going to occur in the skull when the broken end of the bones are pressed inward. So there is a depression. That is a depressed fracture. And then there's a commutated fracture. So in these cases, the bone is broken into several fragments. That is commutated fracture. This is serious because there will be muscle damage with more bleeding at the fracture site. Okay. There's also an impacted fracture. After a heavy fall, the fracture may be impacted by the force. For example, a spinal injury falling from a tree. Okay. So after a heavy fall, the fracture may be impacted by the force. There's also a pathological fracture. In a pathological fracture here, these fractures occur when the bone is weakened by a loss of calcium. You know that calcium is necessary to maintain the strength of a bone. Okay. So it can also occur to infection or cancer. Minimal cause minimal cause a break in such cases. In older age, the bones are more brittle and may break spontaneously due to calcium loss, which is part of the aging process. So in adults, there is calcium loss. So because of that, the bones are brittle. Think of the way glass is. So anytime it can break for any kind of force that is applied. But normally there is minimal. This one causes breaks minimal in comparison to the others. There's also stress fractures. These ones are caused by repeated minor trauma, as in athletic training. So you are always involving the bones like that. So there is repeated trauma. So this one is involved in strenuous training such as jogging or marathon running. So fracture that can result there is known as a stress fracture. So these are the different forms in which we can see a fracture. This is a normal bone. You can have a transverse fracture where the bone cuts like 90 degrees to the length of the bone. An oblique fracture. There's also a spiral fracture running in a spiral way like that. There's also a comminuted fracture, just different like that. Breaks at different points. There's also a avulsion where the bone gets actually to move out. Impacted fracture like this one also you can see. And we said that for an impacted fracture, maybe there is a fall. So there is now an injury like that. There's also a fissure like that. A fissure is basically something like a depression. Okay. So that is it there. And then there's also a green stick, and we say that a green stick is mostly common in children. So there's an injury at just one point like that. You also have a depression in terms for the skull, a depression or a comminuted fracture. And we say that this one you are going to have, of course, a broken, the bone is broken more. Think of it like this one, which is here, broken just at different points like that. So that is how this one also is. What are the signs and symptoms that someone has a fracture? You are going to hear or feel the bone snap. There's going to be severe pain and inability to move the part where there's a fracture. There's also going to be pain over the site of the fracture. There's going to be deformity, abnormal position of the limb. You know where normally the hand or the entire lower limb is supposed to be, but the way it is, you will see, you'll be able to notice that there's a break in the bone. Let's say, for example, the leg points behind, you know that there is actually a break in the bone. There's also going to be bruising, swelling, cryptus, and movement at the fracture site. Okay. Now, how do you treat someone that has a fracture? You can send for help as immediately as you can. Avoid moving the part of the victim that has a fracture unnecessarily. If the fracture is compound, control the bleeding and apply dressing to reduce the risk of infection. Dressing is basically getting to cover that part. You can also splint the limb to avoid movement of the fracture. So splinting is where you use something like, say for example, someone has been fractured on the leg, and then what you do is you get something like, say, I can use an example, a stick. Okay, you put a stick on that part of the leg that has been injured, and then you tie, let's say, a cloth around. Okay, so that is basically a splint. So if possible, elevate the involved limb without moving the fracture. Place a fractured arm in a sling if possible. Keep the victim still until transport arrives to take the victim to the hospital. Reassure the victim, not telling them, "Ah, you are dying very soon, in minutes you are dead." No. Reassure the patient or the victim that is going to be okay. Arrange for transport to the hospital. How do you get to manage a fracture? If it is an open fracture, you're supposed to cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound to control any bleeding. Okay. Also make sure that you support the injured body part to support it from to stop it from moving. This should be easy any pain. This should be able to ease any pain and prevent any further damage. So make sure that you be able to support any part of the body that has been injured. Once you have done this, call medical help while waiting for help to arrive. Don't move the victim unnecessarily. Okay. Protect the injured area by using bandages to secure it to an injured part of the body to stop it from moving. For example, fractures on the arm can be secured with a sling, and a leg with a fracture can be tied to the uninjured leg. So you tie the legs together so that there will be unnecessarily no movements. Okay. Keep checking the casualty for signs of shock. This does not mean emotional shock, but a life-threatening condition often caused by loss of blood. Because imagine there was like a fracture and then there's bleeding. Normally, the person can go into a shock. So you want to make sure that you are watching in case they go into a shock. And if there's someone goes in a shock, we have done what we're supposed to do for someone in a shock. If you have not covered that, please set it and go through it. How to manage shock. If they lose, okay, if they lose responsiveness at any point, open their airways, check their breathing, and prepare to treat someone who has become responsive. So make sure that you assess the ABC: airway, breathing, and the circulation. In case of unresponsiveness, prepare to perform a treatment for that. You can perform, let's say, a cardiac resuscitation in case the heart is not working, or a respiratory resuscitation, you perform a mouth to mouth like that. So that is going to be it for this part. In the next part, we talk about first aid, which is specific for some specific fractures.